Hello and welcome back to my channel. If this is your first time here, I'm Nurse Alyssa, and today we're going to be going over what is a hemorrhage. So it is a heavy bleed, okay? But first, if you could hit that subscribe button, it would be greatly appreciated as it truly does help my channel. So let's get started. So a hemorrhage occurs when blood escapes through damaged blood vessels. Now, it doesn't always have to be crazy severe, because normally when we think of a hemorrhage, we're thinking like severe, okay? They're bleeding out, but they don't have to be severe, okay? It's any time blood escapes through damaged blood vessels, and then it's kind of graded on like how severe, okay? So it can happen almost anywhere in the body because our circulatory system delivers blood to every part of it, okay? So hemorrhage range from a slight bleed from, say, such as when you're shaving and nick yourself, to a bruise where it's bleeding underneath the skin, to severe trauma, strokes, aneurysms, okay? Commonly, like I said, the term hemorrhage is used for sudden and severe blood loss, okay? Now, just a fun fact, in Americans below the age of 40, hemorrhage that occurs due to trauma or car accidents, trauma such as car accidents or gunshot wounds, that is the leading cause of death, okay? Hemorrhage, blood loss. So I'll go over the types of hemorrhage, okay? Hemorrhages can be internal or external. So internal is when you're bleeding on the inside. We can't see it, okay? External, very easy to locate because it's external. You can see where the blood's coming out of. Now, the type of hemorrhage, we have arterial, venous, and capillary, okay? So arterial, this is normally very severe, okay? A medical emergency. Blood, when you hit an artery, it normally goes with the heart pumping, so it kind of splurts out in a pulsing rhythm, so it'll bleed, 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 kind of like squirting out, okay? The blood will be very bright red because it's oxygenated, okay? A venous hemorrhage, this can also be severe and life-threatening because the blood is just going and it just keeps flowing, okay? It's not going in that strong pulsing rhythm, but it's just rather just steadily coming out, okay? Now, venous blood is a lot darker than arterial blood. Venous blood, all the oxygen has been taken out of the blood, so it gets darker as that happens. Now, a capillary hemorrhage, this is often less serious because capillaries are extremely small, okay? So it's thin blood vessels that deliver nutrients through the body, just like a tiny little rivers everywhere. Now, blood trickles out of capillaries until the blood clotting agents clot the wound and cover it up, okay? So normally that's less serious. Arterial would be your most serious hemorrhage. So hemorrhagic shock, okay? This is the most serious level of hemorrhage, is hemorrhagic shock, okay? This is a medical emergency and can quickly be fatal, okay? This is when the body loses so much blood that the heart cannot keep up with the vital systems and they begin to fail, okay? So your body organs cannot get enough oxygen and blood that it needs, so they start failing, okay? There's 4 classes of hemorrhage, okay? Hemorrhagic shock, I should say. And they're categorized by the percentage of blood volume loss, okay? Hemorrhagic shock can begin when you lose about 20% of blood, but even starting at 15%, that's when the heart rate starts really increasing because it's trying to get the oxygen that's needed to those vital organs. Okay, now I did put the 4 different classes here. Not really important that you specifically know, because you're not going to be collecting all the blood, right? So it's more looking at the symptoms that they're having and knowing where they're kind of at and how much blood loss they have lost. But a typical 180-pound adult has about 1.5 gallons of blood. Okay. So symptoms. So external hemorrhage is very easy to spot, like I said, but internal hemorrhage can be a lot more difficult, even for healthcare professionals, to determine that there is a hemorrhage. So we'll go over some of the symptoms. Some of them are same as the symptoms for the shock, but these are the symptoms that you should know: dizziness, nausea, vomiting blood, changes in mental state, seizure, swelling, especially swelling of the abdomen. Okay, if somebody has internal bleeding, they could have swelling. Pale, gray, clammy, sweaty skin, shortness of breath, extreme thirst. And then there's a thing called thunderclap headaches. Okay, so it's extremely severe headaches that peak within the first minute, usually due to bleed next to the brain or spinal cord. Okay, so if there's a bleed on the brain or spinal cord, you can have these thunderclap headaches. So when do we get medical care? So you're going to go to the emergency department or call 911 if you think that there is internal bleeding or there's signs of shock like rapid breathing, pale skin, confusion, or loss of consciousness. If the person is on blood thinners or has a bleeding disorder, they need to seek urgent medical help. Okay? You should get medical help for external hemorrhage if bleeding does not stop within 10 minutes of applying steady pressure, if the wound needs stitches, if you have applied a tourniquet to stop the bleeding, you need to go. Do not take off that tourniquet and you need to go seek medical help. If the wound contains debris that cannot be easily washed out, and if the bleeding is due to a serious injury, such as a car accident, you need to seek medical help. Now, you should be seeing your healthcare provider if you see any signs of infection, or if the when you get the wound, if there's a risk of infection. So say you cut yourself on rusty old steel, you should be going to see your doctor because they'd want to give you a tetanus shot. But if you have redness, pain, it's oozing pus fluid, if you have swollen lymph nodes or glands, if you have a fever or a red streak appearing up your arm towards your heart, or really any part of your body towards your heart, if you have an injury that's from a bite, whether it's a human or an animal, if it's breaking the skin, you should seek medical help. And then if you think you are at risk and need a tetanus vaccine, even if you're unsure, you can always call your doctor and just ask if you should come in for a tetanus vaccine. So other than traumas, there are health conditions that increase your risk for serious hemorrhage, okay? Death from hemorrhage can happen quickly if blood loss is rapid. So what are other risks other than trauma? Okay, so cancer. I've actually seen this probably more times than I've wanted. But with cancer, sometimes it starts eating away at the inside. So somebody starts bleeding, okay? I've seen this internally, and I've also seen this externally with fungating wounds. So it can happen. High blood pressure, diabetes, peptic ulcers, so eroding the lining of the stomach, kidney damage, anemia, so low number of healthy red blood cells, alcohol use disorder, stroke, if you've had a history of a stroke, if you're on an anticoagulant or antiplatelet medication, so it prevents you from clotting, like you should, liver disease, bleeding disorders, and also postpartum hemorrhage. So treatment. So for just minor external hemorrhages, you're just going to clean the area with soap and water if it's possible. But then just take a clean cloth and put direct pressure on that area for at least 10 minutes. Normally, the bleeding, if it's minor, it will stop within that 10-minute time frame. Okay, it will clot. You may have to put something over it nice and tight, just to keep it from not opening back up for a few days. But in severe external bleeding cases, you're going to apply direct pressure to the site. If needed, you can apply a tourniquet and call 911, okay? Get the transportation that you need. For the tourniquet, I always like to give the suggestion, a pen or a stick or a fork, a spoon, whatever you can grab right away. Stick it in the knot of the tourniquet, okay? So get it on there tight as you can, and then make another knot right at it around this, okay? That way you can twist it tighter, okay? It works like a rod to twist it. Now you can use whatever you need, stick, whatever it might be, and you can twist it tighter if needed. If it's still bleeding, it gives you extra support there, without having to take off the tourniquet, if it's still bleeding a little bit. Okay. Now, internal bleeding, it's not something that you can use first aid for. You just really can't, unfortunately. You have to get to an emergency setting, and they will help control the bleeding, all while trying to get significant oxygen to your vital organs. Okay, sometimes they need to give a transfusion or IV fluids to help with that. Okay. So I hope this video did give you a better understanding of what a hemorrhage is and how to control it. And most of the time when somebody is talking about a hemorrhage, it is the severe hemorrhage and not just a bleed, right? Because you can categorize just a small bleed as a small bleed, and you don't need to categorize it as a hemorrhage. But that's all I have for this video, guys. I hope to catch you in my next one. Bye for now.